When the upper trapezius is stubborn and relaxes not at all, or just very little, then you often have to look further afield. It's part of a whole kinesiological team in terms of the upper chest breathing with the sternocleidomastoid and the scalene muscles. So sometimes there's no point in trying to dig a pothole in the upper trapezius. It's going to give you some fuss after a while. But if you can relax the sternocleidomastoid through a variety of manipulations, and or the scalene muscles, then when you come back to the upper trapezius, it's often more interested in relaxing. Sometimes the upper trapezius is hypertonic because if the shoulders have a more neutral posture, the brachial plexus gets compressed between the clavicle and the first rib. So in that case, if you have that kind of irritation, the upper trapezius is never going to relax because to do that is going to cause irritation out the arm. So that might mean that you need to treat the scalenes more thoroughly, or the first rib, shifting the rib down. It may mean that the clavicle needs to be distracted from the sternoclavicular joint or mobilized so that when you push down, it actually it rolls down but actually glides upwards. So if that's lost, then you're going to be in trouble. Sometimes people have a ton of tension in their forearms, so the nerves are all sort of scrunched together here. So when the shoulder is depressed, because they don't have any give here, it creates more tension neurologically there. So sometimes you have to treat their sort of Popeye the Sailor Man forearm muscles. If they're really tense and they're breathing with their chest and not their diaphragm, then you're never going to make a lot of headway. So those folks need to learn how to breathe with their diaphragm. And that can be a tricky thing to learn as well.